KPOA 93.5 FM. Good morning. Good morning. Right about the time here on this Thursday, as we always do on a Thursday morning. Want to welcome into the phone line from the Family Medicine of Glenn Family Medicine, which is located at the Maui Memorial Medical Center Outpatient Clinic. He's here to talk story with us, Dr. Travis Glenn. Good morning, Dr. Glenn.
Good morning, Shane. Great to be with you.
Travis, this is a great subject this morning. First, how often should men get checkups?
This is a really great question, Shane, especially because, most of us guys go to the doctor when we're younger and our parents make us, maybe in high school to do a sports physical, and then we don't interface with the medical system again until something bad happens to us or a friend or our spouse makes us. But it really is important that we change that and that we go to the doctor once a year. And that's important because it gives us a couple different opportunities. One, to talk to your doctor about any questions that you have about health in your life. It gives you a chance to interface with the doctor and learn about any updating vaccines that are coming out or any potential health issues that can arise early. And then the other thing is when we're younger, it allows us to be able to build that relationship with our providers so that they can really tune in advice and make individualized decisions because they know you a little bit better. And that's easier the better that they know you.
Establishing that relationship for sure.
Exactly. So, and then as we get a little bit older, it's important because, I tell patients all the time that our bodies were designed to get eaten by lions when we turn 40, and they've not gotten the memo that we live as long as we do. And so as we turn 40, that's where chronic conditions really start to creep up, and early detection can really help prevent complications later on in life.
Yeah, we men can be pretty stubborn when it comes to our health. When I was young, I was like, oh, no, we can just keep going on and on, but not so much in my later years.
Yep, exactly.
Travis, what are the essential health checks that men should regularly get?
So again, a great follow-up question to that. So when you go into the doctor yearly, the big thing that they're going to be doing is checking your blood pressure. So the thing about blood pressure is a lot of us don't feel if it's high. You don't feel sick. You don't feel like something's wrong. But it can be minimally elevated, and that can have pretty big health consequences down the road in 10 years and 15 years. So a blood pressure screening every 2 years when we're younger, and then that increases as we age as well. Additionally, cholesterol checking in our 20s and 30s, depending on our risk factors, usually about every 5 years or so. And then as we get older, again, that can go as often as every 6 months if we're doing lifestyle changes to try to see how our food and movement are affecting our cholesterol panels. Diabetes screening is another big one. So usually we start this around the age of 45, but if we're overweight or we have other risk factors like family history or elevated cholesterol or something like that, that can also increase in frequency. The other two cancer screenings that we can do for men are prostate exams and prostate cancer screening, and that starts typically at age 50 unless you have other, again, risk factors, which means it can start as early as 45, and then colorectal cancer screening. So this is a big one that changed a few years ago. Most people think of it starting at 50, but that has changed, and we now start colorectal cancer screening at 45. And your doctor's going to talk to you about different things like take-home tests, like an envelope that you go home and would do every year, all the way through a colonoscopy, which most people think of with all that fun prep that makes your toilet your best friend for a night before you go in and have the procedure. And those are just some of the basic things that your doctors will talk to you about or your providers will talk to you about during your annual health checks.
Well, that's a good basic checklist you just gave us, Travis. So, men, if you guys are listening, check. I heard 4 of them when he was talking. So, thank you, Travis, for answering our questions this morning.
Of course. Thanks again, Shane, for having me. It's been great.
Have a great day, and we'll talk again, my friend. Aloha.